right, well, let's get things started. Hello, everyone. My name is Carol Bordinko. Super excited to be here for the second session of the MindShift webinar hosted by O3 World. O3 World helps brands transform experiences across the entire customer journey. We work with some incredible organizations like Children's Hospital of Philadelphia, La Colombe, Vertex, to uncover what customers live and breathe and provide the data and insights that weave solutions in seamlessly and contextually. Today, we'll be talking about how to transform customer experience with data insights. It sounds fancy. I promise it's not. A lot of basic stuff and a lot of stuff that you can learn here. But before we get into it, we have some quick intros. I'll define some key terms that are likely to pop up today, and then we'll dive into our panel discussion. That'll be followed by a Q&A session, so feel free to use the chat functionality to send us your cues during today's webinar, and we'll address those all at the end. Cool. So first up on our brilliant panel, we have Ashley Masterson. She's the Director of Medical Cost Reporting and Analytics at Independence Blue Cross. She also oversees a 10-person department that responds to analytics requests such as medical use trends or identifying members in need of clinical outreach support from various departments all throughout IBX. So thanks for being with us, Ashley. And then we also have Yassi Moghaddam, the Executive Director at the International Society of Service Innovation Professionals, aka ISSIP. She's joining us from the West Coast. Yassi works with Fortune 100 companies, top universities, and government foundations to propel collaborations between industries and academia, resulting in cutting-edge research and value-added services that leverage advances in big data analytics, the Internet of Things, and cloud computing to really help businesses grow and make our world a better place. So super excited to have Yassi here too. And then last up, we have Julia Kastner, who's the VP of Product Management at NeuroFlow, a digital health technology and analytics company. NeuroFlow is the only platform that integrates the digital mental health patient experience with clinical care, decision management, and cost quality management support tools to enable integration of behavioral health into primary care and other practice areas. Julia is also responsible for all aspects of product design, strategy, and data science at the company. So super pumped to have her too. Thanks for joining us. And if you didn't catch it in the beginning, I'm Carol Borodinko. I'll be your host for today. I'm the Senior Marketing Manager at O3 World, and I manage our brand and marketing strategy. So thank you all for being here. It's going to be a great conversation, and hopefully by this point, all of you attendees out there have a beverage, have a snack, you're ready to settle in and learn a lot. We're really looking to work backwards from the definition of customer experience so we could share data strategies that can really move the needle and provide you with some really actionable tips as you're leaving this conversation. In my mind, what customer experience boils down to is the perception of the customer that they have with your brand and how they interact with all of your touch points, whether that's pre-sale with any like marketing collateral or post-sale with customer service. And it could be even broader than that with, you know, how your customers are relating to their personal networks. So those are the kind of things that we'll be digging into today. But like I said earlier, I just want to give us a quick primer with some definitions that will most likely come up in today's conversation. So while customer data platform sounds similar to other commonly used MarTech systems, I want to share the differences between those systems with you. So there's a customer data platform, but there's also a cloud data platform. So a customer data platform's main purpose is to activate known audiences in different marketing channels. This platform has pre-built connections to marketing systems, including email, e-commerce, and digital ad platforms, which allow marketers to use first-party data to personalize the experience delivered to specific individuals. Whereas a cloud data platform is a single platform that provides secure and governed access to all data. It enables your teams to work on common data sets and supports many workloads from data lake to data engineering to data science. Then you also have a customer relationship management system, which is used to document transactions and communications with customers and prospects, and often needs to be updated manually. It's primarily used by salespeople to manage their pipeline, and in a marketing capacity, a CRM system may be used to refer information to a database marketing team that uses email and other channels to market to known customers. Then you have a data management platform, which is used to target ads to anonymous customer segments more effectively. And lastly, you have a data warehouse, which is a relational database that is designed for analytical rather than transactional work. It collects and aggregates data from one or many sources so it could be analyzed to produce business insights. So I just threw a lot of definitions out there. We'll carve through all of them in today's conversation, but really just wanted to orient us with all of those acronyms because they're bound to come up at some point. And then lastly, wanted to hit on that most of us know consumers crave contextually relevant content, right? They want personalized experiences based on an understanding of who they are and what their needs are. So today we'll be referencing these platforms and talking around which systems our speakers, our panelists are using today versus maybe which ones are on their roadmap towards driving to personalization and business growth at scale. And then I just wanted to share a few stats with you guys before we hop in. This one, 40% of marketers have completely unified view of customer data sources, which means that the other 53% are not fully harnessing that to drive incremental revenue and optimize ad spend. And, you know, we know one of the core challenges of CX has been data. We know that data has been siloed, it's inaccessible, not available for engagement purposes, unmanageable at times, and to some degree, it's a liability with GDPR threatening to overthrow data operations completely. So with that in mind, coupled with a global pandemic, I'm really curious to hear what core strategic assumptions or decisions our panelists kind of had to move away from or shift when they knew 2020 wasn't the year that they had planned on paper. You know, what did you guys do? Did you officially change your data strategy for the year? And what was that process like? Ashley, do you want to kick us off?
That's better. Absolutely. I mean, first things first, right? 2020 just, I think, been a weird year. I think it's been a weird year for everybody. Specifically to the industry that I'm in, I come from a health insurer, and we've really been challenged with the fact that the biggest thing that's happened to us is a reduction in utilization because people aren't necessarily going out and receiving the care that they would generally get. And because most of our data is based on that utilization that comes in and the information that comes in to us, we have a lack of data problem, which I think is something that can be relatable in almost any industry, especially in a world where people are just not moving about as much as they have in the past. They're not buying things the same way. I would say Amazon probably doesn't have a lack of data problem. However, companies like the company that I work for definitely do. So we had a couple of different sort of pivots that we had to make this year for sure. I think the most linear or predictable one was that we really had to find a way to leverage telemedicine in a way that wasn't necessarily being leveraged in the past. That was the one way that we felt like we could still get utilization and the information that comes from that utilization in-house. But telemedicine in general, virtual medicine, if you will, had not really picked up across all industries. It was more popular in certain disciplines and certain specialties, but we really had to find ways to kind of go out and start thinking about how we pulled that information in, as opposed to just sort of sitting back and waiting to receive it. So we actually engaged with a lot of our providers and a lot of people in the community to promote telemedicine. You may have seen Dan Hilferty on some ads promoting telemedicine in the region if you're from Philadelphia. But we also worked with our providers to get them set up from a technology perspective and just with the platforms that they needed to make sure that they could do this successfully. One, just to service our members in a way that was safe and helped them get the care that they needed, but also to help us still get information in-house that we needed. And I would say the other thing that we really had to start focusing on was really pivoting to starting to think about leveraging all the potential data we had in the house and thinking about unstructured data the same way that we thought about structured data. So really pushing strategies around translating and transcribing customer service calls and nurse case manager calls, getting that information, that sort of rich, qualitative, sometimes information in-house as well, where we would have before, we weren't necessarily entirely focused on that. It was always kind of on the to-do list, especially since we started switching to more of a B2C framework with the advent of the ACA. But I think this really sort of beefed up our desire and our need to start focusing on those strategies. So we put a lot of effort and time into thinking about what value there is in unstructured data and where did it already exist in our organization, that we could go out and kind of use what was there for us already in a newer and meaningful way. I think we had to be a little bit innovative and a little creative. And that's at least sort of been our experience, but I don't know if Julia, you have some things to add?
Sure, happy to. I think for us, I think there similar lack of data was a symptom of COVID, but maybe in an opposite direction. So for us, a lot of the data that we had about our customers was being gathered anecdotally by our customer success team. And our customers are often also clinicians or providers or small businesses that are running medical practices or larger institutions that are providing medical services. And our customer success team was out in the field speaking with a lot of folks, or our sales team was out meeting with lots of prospects. And when COVID hit, because of the hospitals and medical providers needed to make such a drastic change, they stopped talking to us. So we had a lot harder time getting them on the phone. We certainly couldn't go visit them in their office and have a chat. And so our communication channels drastically reduced in terms of our qualitative information about our customers and our ability to communicate with them. So we actually had to rely much more heavily on our quantitative data to understand, are they still using our product? Are they still doing okay? Starting to calculate things that look like probabilities of retention. And then also our team transitioned to remote, and we found in that transition that what was already a bit of a slow and creaky business intelligence platform was what used to be sort of at the edge of being a challenge was now really unsustainable. So not only did it slow down, people had trouble accessing the information that they needed to track our customers and provide the right success elements to them, but we also started realizing that there were types of data that we were missing. And so all of this together expedited our push to migrate our BI architecture to a new data warehouse, to a new business intelligence stack. So we're in the process of that migration right now. It was on the roadmap, something that we would have done, but we absolutely expedited it as COVID hit and realized the major pain in a new and intense kind of way. Yassi, you want to talk about your experience?
Sure, thank you so much. Yeah, so for us, being a professional association and being virtual, when COVID hit, we internally, there was not that much of an impact, and we tend to be a very data-oriented organization, getting insights from our member companies. What did change is that now we had to be a lot more focused on our members' companies' challenges in light of COVID. So we immediately put a task force together to look at the long-term implications of the COVID crisis, and namely, whether remote working and remote learning would be the thing to stay here. And how does that impact our member companies? We started getting a whole lot more engaged one-on-one. We also tried to get more analytics from Zoom, actually, because that became our main touch point with our member companies, and learn a whole lot more about Zoom and its capabilities. Then we have these workshops and discovery summits that were already planned for the year. And of course, 2020 changed many plans. So we focused our discovery summits on future of work and learning, and future of work really became work now, new modes of working now. And really brought the community together, because everybody was confused and everybody was really scrambling to change ways to find a balance in this new normal. So we immediately shifted some of our programs to focus on how future of work is now. And what does that mean to our member companies' data strategy? Areas where we saw challenge with our member companies, that was a function of our member companies, which are mainly high tech, were not in customer data, but in people data. And how, things that they would need or they already had that could harness to shift to a remote working environment, things for onboarding, knowledge assets for onboarding, data assets, leveraging data assets for onboarding, how to create inclusion and belonging that is very hard to do, not so much for seasoned employees, but especially for new employees, and especially companies that do heavy recruiting from universities and colleges. And last, we saw the ability of businesses to pivot had a lot to do with where they were on their data maturity model. And a good model for that data maturity model is Dell's data maturity model, if you're interested and would like to check it out.
Yeah, I'd say a lot of businesses out there were either, well positioned for the transformation, or they're still maybe trying to get a leg up and figure out their data strategy and move forward. So it's definitely a pressing issue for a lot of people, perhaps some of our attendees even today. So let's shift gears a little bit to present day and how your organizations are integrating data from the 360-degree or working towards the 360-degree view of your customer. Julia, you want to take this one first?
Sure thing. Yeah, I think for us and for most companies, there are lots of places that data come from. And so a lot of what, when we think about integrating data to get the full view, it's about figuring out where the different sources of data are that help to, that are the touch points for all the different customer experiences. So for us as a B2B2C company, there are some data sources and touch points that look more like a B2B company, where we have CRM data, as Carol mentioned. We also have the usage of our B2B platform, and maybe information that our customer success team is gathering in their more qualitative conversations. There are also, on the other side, we have the data that's coming from the patients of our customers or the end users. If we're working directly with a payer like IBC, then we would see their member data, and that's often user-generated data. So as folks use our mobile apps or our web platform, we're gathering information that's clinical, so user-generated clinical data. Some of that looks like quantitative outcomes, so that the idea that folks can give us information about their level of depression or their level of anxiety, and other quantitative measures, but also unstructured data as they write journals or do activities, or we see them interacting with videos. And then we also see general usage data, analytics from the front end of all of those different types of technologies. And so we're starting to think through, how do we pull all of those data sources into one place to tell that whole story about a given customer. And that a lot of that is about figuring out who's using the data and what for. So some of that is about informing clinical decisions by taking a lot of that user-generated patient data, processing it, synthesizing it, presenting it to clinicians in a way that they can take action as a decision support tool. But then also we have opportunities for our internal users to, our customer success team or our sales team, to be able to understand the usage of our platform, the outcomes that we're seeing over time, and have that inform our marketing content and the way that we communicate about what we do, but also potentially when to take an action, a proactive action, to improve the customer experience and to make sure we're being extremely proactive. And so our larger data warehouse project is about bringing a lot of those sources together, but we already have a lot of information in our core platform that we use in a lot of different ways.
Awesome. That all makes sense. A lot of data flipping around and synthesizing going on and getting the right people's eyes on it and passing it along. Ashley, how about at IBX?
Yeah, so I think to some extent, right, I think we see a lot of the same types of things that Julia was just talking about. And we have to be focused on making sure that we're pulling in the data that we have available. And, I always joke that I feel like we're maybe 320 or 330 degrees. 360 is real difficult, but I think that's all what we're striving for, right? But I will say one of the things that we've really focused on from sort of a customer experience and thinking about 360, not just in sort of our perspective of 360, but really we've been focused this year on what's the 360 perspective from the members' point of view. Sort of what I mean by that is there are a lot of experiences that they have that are tangentially related to our brand. Sort of tertiary, we were talking about this a little bit, I think, before the panel started, sort of these tertiary influences of how they experience our brand. So we've really been focused on two kind of areas where we can look at data to understand from a member's perspective, what's their 360-degree view versus kind of our 360-degree view of them, which is also, obviously very important. But the first being, how does a member sort of engage with their own health journey? And are there ways that we can use the data that we have to help them engage more with their health journey? Can we push out applications? Are there partnerships that we can do where we can have a member potentially be doing journaling or taking meditations or really kind of taking control to the extent that they can? And what influences do we have on how a provider engages with our members and how our member perceives that provider engagement or that provider interaction? So are there things that we can do to make sure that a member is well set up for that engagement with their provider? Can we send them, we send them checklists or potential questions? Here are some things to ask. Are there different ways that we can help promote improving that experience, that customer experience? Because it is all sort of tangentially related to what we do. At the end of the day, they're using their card during those experiences, and it becomes very important and very reflective on us how those experiences go, whether or not we actually have a physical hand in what's happening there. And I think the other place that we've really started to think about from a member's perspective is, it's a hot topic, I know, in healthcare right now, but I think it, again, sort of applies across all industries, is, we call it social determinants of health. But in general, I think what we're really talking about is, what does an individual's life experience and the way that they're sort of perceiving their world, how does that impact the other things around them? And so again, thinking through this concept of going out and sort of pulling data in as sort of, instead of being a receiver of data, which I think has sort of always been our default, is the data comes into us, the claims come into us, and that's the information that we get. Where can we go out and get publicly available data? What community partnerships can we work with? There are great organizations like PHMC, and we've worked with several different groups in the community. The city of Philadelphia is not only a customer of ours, but also a partner. And there's tons of publicly available data through the census in the city and things like that. So going out and really sort of scraping that data, insourcing that data, and understanding what's the member's perception, and what does their 360-degree view kind of look like, has really changed the way we've started to develop our 2021 strategy, because we're thinking about things less from our perspective and more from their perspective. And I think that's really kind of been a shift that we've made in the last year.
Awesome. Thanks for sharing. Everyone's shifting at this point. It's definitely a lot to kind of grapple with, and reinforce that you're pulling the right data, especially from a healthcare perspective, and kind of expressing what you're doing with that data. But Yassi, did you have anything to add there?
Sure. For us, being an association focused on service innovation, we start with that. We start with kind of grounding ourselves that our role is to promote value co-creation between all stakeholders that are involved in creating customer value. Also, with that in mind, taking an inventory of data assets and really being clear as to, we see 5 categories of data assets, which is the people, whether, those are the people inside your company, customers. So the customer analytics is one component of it. It's also very important to have people analytics and correlate the two, because it's the engagement that needs to be improved for improved customer experience. And also data assets regarding work and tasks, workflows, as well as our offerings, bringing those, having a view of those 5 data assets really helps us create a 360 view. And this is something we promote with our member companies. We do analysis on customer touch points, and on those customer touch points, we look at both pre-sales and post-sales, because marketing data is very important. So is customer service data. And then, we do customer journey mapping along the touch points. Along the touch points, there are different modes of integration. There's email, there's website, there's search engines. And then we focus on not all the touch points, but the high traffic touch points. So, we use the 80-20 rule. Basically, 80% of our efforts should be on the 20 highest touch points, challenges that we have. And then, identifying where customer experience, where our brand promise really doesn't align with the customer experience, and really focusing on those to focusing initiatives to improve those. We also, with our member companies, we have workshops to promote these models, and we hold discovery summits on those topics, how to align a service thinking mindset with business strategy and with data strategy, because they all go hand in hand.
A lot to unpack there. Definitely a lot of things going on with all of your organizations with, what's the right amount of data to collect and what do you do with that data and how do you move forward to empower your customer experience based on all those like touch points, and analyze that. So that kind of leads me into our third question with how are you guys, I'll say, using data to anticipate customer needs and deliver what they really want and staying relevant? Ashley, do you want to take this one?
Sure. There we go. I really need to learn how to use that mute button a little bit better.
Don't worry about it.
So I would say, I think there's a lot of opportunities for us to put ourselves in the customer's shoes, and really start to try to think about, what are the things, what's the next step? What are the things that they're hopefully looking for out of an insurer, and is it more than just us paying claims, which I think it obviously is, especially in a world where these individualized experiences and customer experiences are so important, right? We're having a webinar about just that. So I think some of the places that we've been really focused is looking at everything in terms of a journey. This sort of journey mapping is something that we've really sort of taken seriously, I would say, in the last 2 years, maybe 18 months even, as an organization. Shameless plug, we have a really great innovation group over at IBC that helps us do a lot of these sort of journey mapping activities and really building, what we consider patient or member journeys. But again, I think are similar to experiences that you have in sort of any organization. So really starting to think about what are the barriers or challenges to the things that we want to do. So we start with what's the problem, or what's the thing that we want a member to do. And we've, just as some sort of concrete examples, we've gone through several of them in the last couple of years, but you think about when somebody leaves the hospital, anybody who's ever had a family member in the hospital or has been in the hospital themselves, there's a lot to coordinate when you leave, right? There are medications, there are follow-up appointments, there are a lot of things that are going on that you're sort of bombarded with all of this information about. These are all the things that you need to do. And what then happens sometimes is what we've seen in the data is that sort of traditional activities get left behind, or we have members who are in situations where they have to make choices. So, one of the programs that we've put into place involves a partnership with MANA, a community organization that delivers meals. So we have members who have multiple comorbidities who are discharged from the hospital, and we also, while working with them to coordinate their appointments and things like that, have meals delivered for the first 6 weeks to make sure that that's just one less thing that they have to think about, because it can be very overwhelming, right? And that came from literally one of our leadership having a mother that was in the hospital and had gotten out, and just trying to coordinate all of that information. So really kind of thinking about these things in terms of journeys. And one other place I'll mention that we, are really focused on journeys right now is with our partnership with Quill. And we're thinking about those journeys in a broader sense than just sort of the clinical journeys that we're, primarily focused on at IBC. But our partnership with Quill allows us to put a lot of content potentially in people's homes via their Xfinity boxes. And so we started thinking about, what does a caregiver journey look like? What does sort of the postpartum journey look like? What are some of these other places where we may or may not have a perfect grasp on what that experience is going to be, because we may or may not be able to control it from a health insurer perspective, but can we at least give the tools and those items to our members for like the other sort of stressors that are going on in their lives? So really just kind of sort of trying to anticipate that component, I think, has been the journey perspective is really the concept that we've taken forward a lot. I don't know if Julia, you guys have any additional thoughts?
Yeah, I think having a journey story and then sort of validating it with data is really a beneficial way to understand. So I think that's definitely part of our process as well. I'd say for our current initiatives, we really have three around sort of being as proactive as we can with our customers to improve their experience. So one is working with our customer success team to empower them with more data and alerts, so that if a customer isn't tracking the way that we would hope, or we think we're sort of predicting that they may not track the way we hope, our customer success team can be more involved in triage and making them more successful earlier on. So we're starting with some sort of simple dashboards for our customer success team so that they can start to see who rises to the top of these lists and needs more of our help. And then we'll be transitioning to using the data that we're putting into our data warehouse to empower them with their own tools, the ability to customize their own alerts based on metrics that we all agree on are the important ones. So that's one of our big initiatives. Another big initiative that we have is a part of our core product offering, which is to offer our providers, our clinicians, with the right data synthesis and alerting on their patients so that they can be as proactive as possible in terms of triaging, engaging, or intervening with patients who need the most help. Part of that is looking at algorithms that help with risk stratification. So looking at all the data that we get from patients and figuring out who's in which bucket, but also working on personal baselines for those folks to help alert the providers when the patients deviate from their personal baselines, and even thinking about how do we make sure that those algorithms are fair and unbiased, secured, and privacy enabled, so that the right people are getting the right data at the right time to take action to increase outcomes and level of care. And then the final really big initiative is our relationship with the customers of our customers. So with those end patients, how do we, sort of similar to what Ashley was saying, have a really consistent journey for them and have different types of communication channels or touch points that allow them to be the most engaged with us and get the most out of what we're offering. And so we're actually in the midst of investing in a really big new analytics stack. So the maturity model on this side, which I would say sort of a testing, analytics, and personalization journey, is that you start with making sure you're collecting good data. Right? So as an organization, you want to make sure that you have the right data to understand how a consumer population is using your technology or interacting with you. Then from there, you maybe start testing. So you can run simple A/B tests, maybe just on the front end of a website, or in our case, within the app, to get a feel of which kinds of experiences are most engaging and be proactive about who's going to be engaging with what. A next level is where we are now, which is creating a full stack multi-channel testing platform using technology to be able to test our notifications, which channel a person might get, timing, stuff that's sort of in the guts of our product experience can now get tested, customized. And then so final level that you move towards is true personalization of being able to make sure that everyone gets exactly what they need at the right time. We have some other types of personalization built into our patient experience. So for example, if you score highly on depression, we'll trigger you depression content. And that's part of our core clinical offering. But there's so much more personalization we could do about things that look more like recommender systems, like if you've watched this video, watch this other video, or personalizing the types of channels if we think that you're more likely to want a text message? How do we be proactive and not force you to configure your own settings, but start to intuit what's going to be best for a given user? So those are the three really big initiatives that we have about getting more proactive with building good customer experiences.
Right on. Thanks for sharing that. I love that you're both, well, that Ashley, you're teaming up with your innovation team and working through your customer journeys, and Julia, you're doing the same thing, just working towards getting to that personalized state, that better customer experience, and that predictable customer experience that's not like so much on the manual side, and it's more automated. Cool. So in the spirit of working towards personalization, and that being our nirvana state, I feel like there are a lot of, I'll say, obstacles, challenges that could come up in getting to that final state. And I'd love to hear, and this will be our last question, and we'll break out into the questions that have been coming through from our attendees. But what advice can you guys offer on overcoming challenges related to data collection and data insights, and gaining that real, like, relevant customer knowledge that's going to drive the engagement that you're seeking? Yassi, you want to take this one first?
Sure. So I think first and foremost, we think business strategy has to be aligned with data strategy. And when conversations are around business strategy, that has to be included. So it's really important that it is a top-down supported effort as well as bottom-up. And have an overall goal in mind to improve on data maturity model, whatever data maturity model you use. Have that as your big picture. Then I think it's really important that issue of skills, the topic of skills is really important, because we're really transitioning the entire workforce we must be transitioning the entire workforce into a data-minded, probabilistic thinking workforce. And so making sure that your organization not only has the data experts, the really brainiacs that do all the sophisticated statistics, but also, I call this developing this zoom in, zoom out capability in your organization across the board, because face it, we are dealing with complex systems as organizations, and that the ability to really zoom in and zoom out is really crucial. So you want data experts to have the skills that then ask the right questions in order to develop the insights that impact business results. And also you want the non-technical people to have enough analytics skills that they can incorporate analytics in their daily life. I think there's also an element of, there's definitely the element of technology and data maturity, but also there's an element of culture. I think encouraging a data analytics driven culture is really important. And that really happens from a top-down senior leadership place. And, to that point of culture, fostering design thinking in the organization, agile methods, probabilistic thinking. You know, we like to say service thinking, which means really a mindset that you co-create value with others, whether it's others in your organization or with an end customer. Promoting those kind of skills will lead to better collaboration and value co-creation with customers. Then, you know, get a pulse of where your organization is on the data maturity model and foster ongoing learning and a growth mindset as you move through the stages of the maturity model.
Those are great tips. Thanks for sharing. Julia, anything to add there?
Yeah, I absolutely agree. I think business priorities are always the place to start. So for example, for us as a small startup, one of our major priorities is growth and scale, both in terms of the numbers of customers that we can bring on, but also our scaling internal teams. And that's driven a lot of the kinds of metrics or projects that we're doing. So for example, our data warehouse migration is all about bringing scalable data solutions and also consistent, trustable, well-defined metrics to our growing organization so that we can have a shared vocabulary. So I think that part of the culture change that Yassi was mentioning is about having that alignment with the corporate vision and sort of what the company's really trying to do, and then also empowering all the folks across the organization to be able to make decisions the way that they want to. I think it's also a challenge to think about the type of industry that you're in or regulatory environment. So Ashley and I are both in healthcare, and there's a lot of extra challenge there. So as we've evaluated tools and systems, we've had to make sure that they have the right level of HIPAA compliance. We have to make sure that they're not going to get in the way of a FedRAMP certification or a high trust certification. And so there's some added complexity depending on what type of organization you are, what kinds of tools you're going to need to bring in. And these are really big, expensive projects. So then having that strategic buy-in ahead of time becomes even more important to be able to then have a conversation about how much you're willing to invest in all of these types of things, because each of these projects we've discussed today is a massive undertaking. And so you need to make sure that you're doing the full ROI analysis around them.
Right on. Ashley, any final thoughts or?
Yeah, I mean, to Julia's point, right, we operate in a world that is highly regulated. And it, you know, the second you say something about challenges, especially in this space, collecting data, I think that's where all of our minds just immediately go. I think the biggest barrier to insights that I found in my organization, and you know, this probably is different depending on sort of the age of the organization, but you know, we are a well-established organization. We have very long tenured staff and associates at Independence Blue Cross. And I think that sometimes one of the things that's really important to start thinking about is not letting the past get in the way of the future. So really making sure in your organizations that when you do potentially build these patient journeys or start thinking about innovation, that you have the right mix of associates in the room, and that, you know, you create safe spaces in those environments to talk about the potential of projects that maybe were tried 20 years ago and didn't work, and what that sort of sounds like and feels like in an organization. Just really kind of create a culture where you can overcome some of those like insights challenges. Because I feel like a lot of times we can be held back, especially in a very mature organization.
Makes sense. Thanks for sharing that point as well. So to jump right into Q&A from our attendees, we had a question. Doug wants to know, what types of internal protocols are you considering for access and usage of data? And Julia, this one's specifically for you. You want to take that one?
Sure, I'm happy to chime in, but I bet Ashley has some thoughts on this one as well. So for us, we're a HIPAA compliant healthcare company. And what that means is that we do a quarterly review of all of our policies and procedures. And that's where we evaluate and create those internal protocols that you mentioned. So for example, figuring out which of our engineers have access to full HIPAA level personally identifiable health data, and which of our team are not going to have that kind of access, protocols for how we escalate access if it's required. So only those who absolutely need it are going to get that kind of high risk access. We're in the process actually of building more tooling so that a broader and growing engineering team can have access to the guts of the system without touching any of that personally identifiable information. So building more walls around it is another one of our processes. But it's also about culture too. So we do regular HIPAA trainings around awareness, making sure, even our temporary staff are trained and not clicking on random links in their emails and stuff like that. So having a culture around care and responsibility of the data that we do control, as well as developing protocols and systems, regular audits to make sure that we're being compliant and careful with the information that we have. We actually just went through a bit of a change in those policies that is part of our warehouse migration. We realized that our head of data, Bill Lynch, who might have been on this webinar joining us today, that in order to do his job more effectively and have a bigger role in this migration project, would need a higher level of HIPAA access. We went through a review, we made sure that made sense. We did sort of the cost benefit analysis, we updated our policies, and then we gave him access. And so you need to be nimble enough to move forward and be able to get good work done, being able to access unstructured health data to do natural language processing is just as important as keeping it protected, right? Because we want to be able to provide the right level of care. And so sometimes that means finding these tricky middle grounds where we have a couple of exceptions, but that the vast majority of our team doesn't have access. We actually have another upcoming challenge, which is about we're starting to sell our product to a payer to then roll out at a health system. So for someone like an IBC to roll out at someone like a Penn. And what that looks like then is that our customer is going to want data about a population that may not be related to them at all. And so how do we find the right levels of information and access and be able to share it with them in a careful way? And so that's a lot about data architecture and technical design to make sure that the right tenants get access to the right kinds of information.
Got ya. I'm gonna move into the next question. Ashley, are you okay with that? Or you have a burning desire to add on?
I don't have a burning desire. I could talk about that for 10 minutes, but I'll save everybody the pain of listening to me speak, so you can definitely move on.
All right, we've got 7 minutes left here. We're going a little over. I want to make sure we get to these last final questions, so thanks for understanding. This other question is, what kind of benchmarks of specific metrics have you put in place that you could share? It's always challenging to determine actionable plan and set realistic expectations internally. Any takers on that one? Yassi, does that kind of fall, like, can you speak to maybe
Sure, I can speak to it, but really specific metrics are specific to industries. But I can give a framework how to think about that. So, looking at your touch points, pre and post sales, where, typically the touch point starts with customer awareness, then the customer consideration, then purchasing. This is the pre-sales cycle. And then there's the usage of your solution, support of your solution, and then renewal, hopefully, if the customer is happy, renewal of service or repurchase of new products. Then then looking at the customer framework, which is basically looking at these parameters, awareness, consideration, and so on, and looking at how you're engaging, what data sources you're using to engage at every point, and then defining KPIs relative to that that matrix. It's hard to explain that without a picture, but I hope I.
No, that definitely tracks for me. I feel like what some people struggle with, or even like larger organizations struggle with, is analysis paralysis and having too much data. So how do you cull that down and hit your key performance indicators and align on those with all of the other people within your organization? So it's a question.
And you don't have to do it at all those touch points. It's the high traffic, most troublesome touch points that you want to focus your efforts on.
Anybody else want to chime in there?
Yeah, I would just say, as part of what my organization does is we support the evaluation, a lot of the evaluation work for a lot of the vendor partnerships and a lot of the programs that we do at Independence Blue Cross. And when I came into the organization, I think we had a set of KPIs that we had sort of decided were the right things to measure. And those things specific to our industry, but sort of generally boiled down to total cost of care and sort of what those metrics looked like. And in the last few years, we've really taken a shift under new leadership to start thinking about asking the question when we do an evaluation or set benchmarks as to what does success look like, right? What's the goal of the program? And if you start with that conversation, almost anybody in the room has an answer to that question. If you ask somebody, what are the KPIs that we should measure? I get silence. But if you ask, what does success look like? What's the end goal of this program? You then have a picture of what it is you're trying to do, and that becomes much easier to measure. So it just sort of a mind shift, see what I did there, of how we ask that question. I think we get to the same answer, but just a little extra perspective.
Yeah, I totally agree. And I would only add that you can also ask them, what would failure look like? Because you should probably measure that too.
1000%, yes. Totally agree.
All fair takeaways. Love it. Last question here, and then we'll wrap things up. How are you shifting and evolving your data analytics strategy to stay as forward-thinking and relevant as possible? Any last thoughts on that one?
I'll note on the technology consumer side that technology on the consumer side moves really, really fast. The technology on the B2B side moves quickly, but it's not the same as what consumers expect. And so I think having a good perspective of what good experiences are, what good customer experiences are across the consumer landscape in general is just as valuable as measuring your own world and your own ecosystem. So for example, my team's been tracking the recent brand migration for all of the Google Drive technologies and talking about, like, was this change communicated in a way that made sense, and how are they probably measuring the success of that brand migration? There's a ton of new tech that's evolving around AI and cool stuff that's happening in VR. And so keeping track of what's going on out there, and then taking those technologies or innovations or good experiences, like when was it the last time you had a good experience with your with a retail store that you would love to replicate, or a bad experience with a hospital that you would like to avoid? And then how would we measure internally to make sure that we're moving in those directions? So I think that a lot of that staying forward thinking and relevant is first about strategy and inspiration, and then tying that back into tactical execution.
Yeah, I love that you're looking at comparative experiences as well. I think that's like a huge point there to hit on. Anyone else? Any closing thoughts on that last question? Got 1 minute left. All right, I think we're good to close things out. I think some big highlights for me revolved around how can we make smarter and quicker business decisions that truly impact our customers, but we're doing it in an efficient way. we're, you know, making sure we're doing it in a compliant way in terms of healthcare, and that we're working towards that personalization goal of providing our customers what they want, when they want, and anticipating their needs. Any additional thoughts there, team? No? All right, cool. Well, thank you all for joining. This was a wonderful conversation. I appreciate the panelists. I thank you for tuning in. I hope you learned as much as we did, and I'll be sharing a recording of this shortly. So stay tuned. Thank you all. Have a great day.
Thank you. Bye-bye.
Bye, ladies. Take care.
Bye-bye.